out myself at this point in time, which is a good thing. And thank you very much to Yasmin and the Southeast LHIN for this opportunity to present our infection control surveillance system for you today and what we've learned this year and our progress. So I'm going to start off with talking a little bit about what our vision is. And sometimes I've been criticized for dreaming in technicolor, but I do have a large vision which hopefully someday will take this project forward beyond hospital walls. But first of all, our scope is to take this project into the hospital. I'll give you some background, just some background about infection prevention and control. A couple of slides just so you have some context, because some of you may not be familiar with infection control programs. A little bit about our surveillance project history to date over the course of this year, our journey in the last few months, which has been tortuous at times, and the benefits of a regional system, a regional surveillance system in both locally but for our region to help our clinical leaders, help the local health integration network, help myself understand what the burden of healthcare-associated infections is in our region, what that means in terms of cost, what that means in terms of length of stay, and what that means as far as wait times as well. A little bit about challenges and lessons learned. I think some of the challenges were covered off by Paul earlier in this morning's presentation. So the vision is to establish a regional surveillance system for standardized reporting and tracking of patients with healthcare-associated infections. HAI stands for healthcare-associated infections. Sometimes you'll see people saying hospital-acquired infections, but in fact, infections can occur in other settings besides hospitals. Healthcare-associated infections can occur in the home care setting if those providing care in the home do not observe good techniques with respect to asepsis or with hand hygiene. So healthcare-associated infections can occur anywhere where care is provided by a health service provider. We also, through this project, hope to identify factors which prevent the timely discharge or transfer of those patients who are designated as alternate level of care. And we know that some of those patients, as they're waiting for discharge, are getting infections in the hospital, and that delays the transfer. And we don't understand the burden of that or how long it takes to get them out, and we want to be able to identify that and quantify that. And as mentioned earlier, what is the economic burden? How should resources within our region be reallocated or targeted or marshaled to address the problem and the significance of healthcare-associated infections? This is a regional e-health priority, and I've had the benefit of working with Paul and the IT team across the region, as well have had LHIN support in moving this forward. This project is supported from Ministry of Health long-term funds that came into the network as one-time funding. This is a one-time opportunity. So an HAI, a healthcare-associated infection, is an infection that was not present, nor was it incubating upon admission to the facility. It was acquired in the hospital or in the healthcare setting. Many hospital-acquired infections or healthcare-associated infections can be prevented through proper hand hygiene, through use of infection control techniques applied consistently and timely, and active surveillance procedures. We can't measure our interventions if we don't know what's out there. We can't measure the effect of what we're doing unless we have good data. So what's an infection control program? Well, I think they should be called, what is an infection prevention program? I think we should be on the other side. We shouldn't be controlling infections. We should be actually preventing them from happening. The principal functions in all institutions are basically the same. There may be a bit of difference based on the case mix, the acuity, the service programs delivered in those institutions. But essentially the functions of an infection prevention program are similar. And the first one is to obtain and manage critical data and information, including the surveillance for infections, to develop and recommend policies and procedures, to intervene directly to prevent infection transmission, to educate and train not only the healthcare workers, HCW, healthcare workers, and non-medical caregivers, but to assist was education of patients and their families. Because as mentioned earlier, not only is it the patient that requires education, but sometimes it's their families who are supporting that patient upon discharge that needs education as well. Infection control professionals, or infection prevention and control professionals. Well, how many are there in Canada? Well, there's about 300 certified infection control professionals in Canada. And unfortunately, that only represents about 20% of the people who are members of our national association. So we really have a long ways to go in getting our membership in our national organization certified to be a CIC. How many infection control professionals are in hospitals? Well, there's one FTE per 115 acute care beds, with a minimum ratio of 1 full-time equivalent infection control practitioner for 100 occupied acute care beds if there's high-risk activities such as dialysis, and additional allocations based on the number of intensive care beds. And the reference for this is the Provincial Infectious Diseases Advisory Committee from the Ministry of Health and Long-Term Care in their best practice statement that was released last year on infection prevention and control programs in Ontario. So what do ICPs do? Well, they observe practice. They conduct audits. They educate staff, visitors, and patients, and they prevent the spread of infections through ensuring that there's compliance with hand hygiene, use of protective apparel, and ensuring that isolation is commenced immediately upon suspicion of an infection process. They are visible. They have to be visible to do this work. So why are hospitals struggling with infections? There's many reasons. There's a higher acuity of illness in the hospital. There's more complex procedures and diagnostic interventions going on. There's poor design of our hospitals right now with crowded rooms, 4 in a bed ward, and difficult sometimes for our staff to actually access a hand washing sink or personal protective equipment. There's a lack of compliance to hand hygiene and other important infection control measures. How do you